Hello, welcome back to this channel where I talk about topics related to health, including medical advice and fitness tips. So today I'll be taking you through an interesting topic, which is contraceptive. Oftentimes it is used synonymously with family planning, though family planning is much more than contraceptive use. It involves things like child spacing, pregnancy interval, and many other things. The history of contraception dated as far back as 1850 BC, when highly acidic concoction of fruits and nuts are placed into the cervical os so as to create a spermicidal barrier. Today, the world is currently facing the crisis of rapid population growth. In fact, it is postulated that in 40 years' time, the population of the world is going to double. So what are contraceptives? Contraceptives, also known as birth control methods or family planning, are simply methods used to prevent pregnancy, and there are quite a varieties of them. While some are reversible, some are permanent, some are not only used as birth control, they can also be used to prevent sexually transmitted infection. Some can be used to treat menstrual disorders like PCOS. We also have the male types and the female types, although the female ones are more common. So before opting for any contraceptives, I think it will be important for you to know about them so that as the doctor or the nurse is taking you through them, you'll be able to make informed decision. Mind you, not all of them have 100% efficacy, as even the best of them can still have a 0.001% chance of failure. Contraceptive can be divided broadly into two. We have the natural and the artificial. The artificial method is further divided into temporary and permanent method, and so I'll be going into the details of all of this. In natural method, we have three types. We have the courteous interrupters, lactational amenorrhea, and abstinence. In courteous interrupters, it is a situation in which the man tries to withdraw just about the time he's going to ejaculate. The aim is to avoid getting semen into the vagina. However, this can fail as what we call pre-ejaculate can contain significant amounts of sperm which can get you pregnant, or there could be spillage of the semen while trying to withdraw, or even due to lack of self-control. In lactational amenorrhea, so after birth, the hormones that are responsible for production of breast milk will try to suppress the hormones that are responsible for ovulation. So as long as a woman is not ovulating, she will not be able to get pregnant. However, this can fail you because the month ovulation is going to occur after delivery is unpredictable. And then we have abstinence, which is no sexual intercourse. However, periodic abstinence can be practiced if the menstrual cycle is well mastered through the use of calculation method or symptomatic method or cervical mucus method. In temporary method, we have the use of mechanical barrier, hormonal contraceptives, and the use of intrauterine devices. Mechanical methods include the use of condoms, which are perhaps the most commonest one. We also have the cervical diaphragm, cervical caps. They help to serve as barrier to prevent the passage of semen into the cervix. They are not only used as contraceptives, they can also be used to prevent sexually transmitted infection. They, however, do not provide 100% protection as there can be leakages, they can break, especially from improper use. We have spermicidal agents. These are like creams that can be applied into the vagina. They prevent sperm from entering the cervix and also reducing their motility. Under temporary method, we have the hormonal methods. The hormonal methods are quite popular as well. They come in various forms such as implants like Implanol. It can also come as injectables like Depo-Provera. It also comes in pills like progestin only pills or combined oral contraceptive pills. They also come in form of patch that can be applied directly on the skin or as vaginal rings that can be inserted into the vagina. In whatever form they comes, they contain hormones such as estrogen and progesterone, which help to suppress the luteinizing hormone surge, thereby inhibiting ovulation. They also prevent endometrial development and growth and also reduce cervical mucus production. In short, basically making fertilization impossible. Each of them have duration of efficacy ranging from months to few years. Still under temporary method, we have the intrauterine devices, which include the Copper T380 and Mirena. These ones can last for as long as 5 to 10 years. So these are devices that are laced with hormones. They are placed directly into the uterus. They help to prevent ovulation and at the same time prevent implantation of a fertilized egg. In the permanent methods, they are surgically done. In females, we have tuber sterilization, tuber ligation, or total tuber removal, while in males, we have the vasectomy. In conclusion, in deciding the right contraceptive to use, you might need to consider the following factors. How often do you have sex? Do you still want to get pregnant one day? How soon? Do you have any medical conditions? Will you be able to use this contraceptive correctly each time? Do you also want to prevent infections like HIV and sexually transmitted diseases? And can you afford it? Because some contraceptives are expensive while others are relatively cheap. Thank you for staying till the end of this video. I hope you've been able to learn one or two things, and I hope that this has really helped you in deciding the type of contraceptive